You wake up in the morning feeling completely normal. No pain, no warning signs, nothing unusual. You make your tea, sit down, and check your phone. And there it is, a missed call, a voicemail from your doctor's office. Hi, we just need you to come in for a follow-up test. Basit nahi, no explanation. And suddenly, your entire day feels different. Your mind starts racing. Follow up for what? Is something wrong? Why didn't they explain? By the time you sit in that waiting room a few days later, you've already imagined a dozen worst-case scenarios. And here's the part no one tells you. That one routine test, the one you didn't even think twice about, may have just started a chain reaction you never needed in the first place. I'm Dr. Alex Carter. I've spent years studying medical research and clinical gerontology to help seniors understand the truth about their health. Today, I'm going to tell you something most doctors simply don't have time to explain during a short appointment. Not every routine medical test protects you. In fact, some of them quietly lead to unnecessary treatments, stress, and even harm, especially after age 65. To understand why this happens, you need to understand something I call the cascade trap. It works in 3 steps. First, one small finding leads to another test. Second, uncertainty gets treated like danger, even when it isn't. And third, the system pushes toward action. More tests, more procedures, more interventions. After 65, the medical math changes. I call it the benefit-burden calculus. Today, we are looking at 5 tests where the burden often outweighs the benefit. The first is routine PSA testing for prostate health. Take Robert, a 68-year-old retired engineer. A slightly elevated PSA led to a biopsy, which found a low-grade cancer so slow it likely would never have bothered him. But the treatment left him with urinary incontinence. The U.S. Preventive Services Task Force gives this a grade D for seniors, meaning the harms often outweigh the benefits. For every 1,000 people screened, you might save 1 life, but you risk ruining the quality of life for over 100 others. The second test is annual Pap smears and pelvic exams. If you are over 65 and your results have been normal for the last decade, the guidelines are clear. You can stop. At this age, natural cell changes often lead to false positives, which trigger scary, unnecessary surgeries that offer no real protection. The third one shocks most people: routine colonoscopies after age 75. While screening is vital in middle age, the risk of tearing the colon doubles once you hit 75. Often it isn't the test that causes the problem, it's the bowel prep that leads to severe dehydration and hospital stays. At this stage, the risks often climb higher than the potential rewards. Number 4 is the routine EKG for those with no heart symptoms. The heart has many normal variations that look strange on paper but aren't dangerous. For a patient like James, a routine EKG led to an unnecessary angiogram, and the dye used in that procedure damaged his kidneys. Finally, number 5, the carotid artery ultrasound for people without symptoms. This test looks for narrowing in the neck arteries. Many people, like Barbara, spend months in terror after a borderline result. Yet, the surgery to fix that narrowing carries a 1% to 3% risk of actually causing a stroke. Without symptoms, this test is often just a way of selling fear. I don't want you to be afraid of medicine. I want you to be an empowered decision maker. Before agreeing to any test, ask your doctor 5 questions. What is my personal risk? If this result is abnormal, what is the next step? What do the national guidelines say for my age? What are the chances of a false positive? And what happens if we choose to monitor instead of test? You have spent 65 years taking care of your body. You deserve healthcare built on wisdom, not just routine. If this helped you today, please subscribe. And tell me in the comments, has a routine test ever led you down a path of unnecessary worry? I read every story. I'm Dr. Alex Carter. Take care of yourself, and I'll see you in the next video.